everyone, this is Suprava. Welcome back to another session with me. So in today's session, we will basically discuss about organization of neonatal intensive care unit. Basically, this neonatal intensive care unit is specifically designed for, neonates. So if there is premature babies or if there is ill newborn, for them, this unit is specifically designed for them. Basically, in this neonatal intensive care unit, we manage the complex life-threatening diseases and we provide intensive monitoring and therapies in an organized manner. Now, as I told you that this unit is specifically designed for neonates, but I also mentioned that if there is premature babies or ill newborn, then only we transfer them to neonatal intensive care unit. Let us see what are the conditions which require care in neonatal intensive care unit. So there are certain conditions which can be life-threatening for the newborn, such as apnea, or if there is respiratory distress in the newborn, and sometimes we can see birth asphyxia, and we need to perform neonatal resuscitation. These are the conditions which is considered as life-threatening for them. So in that case, we would transfer these neonates in the neonatal ICU and we would provide the care there. Apart from these things, if the neonate is having convulsions, meconium aspiration syndrome, or if there is severe jaundice, and also if we have infants of diabetic mother, or if there is meningitis, or any such conditions which need immediate surgery after the birth, and also if there is any congenital malformation. So these things required care in NICU. So if we have any newborns with this kind of conditions, then we would transfer them to NICU. So the main aim of this neonatal intensive care unit is to reduce the neonatal mortality and also to improve their quality of life. And as you know that there is an increased incidence of neonatal mortality, and if you see the causes, most of the causes are conditions which I mentioned just now, for which we need to transfer the neonate to NICU. So these are the conditions, for example, birth asphyxia or respiratory distress syndrome. These causes neonatal mortality. And to manage that, we have neonatal intensive care unit where we provide intensive care, intensive monitoring and therapies. So basically, our main aim is to reduce the neonatal mortality and improve the quality of life. So what are the objectives of providing care to a child in intensive care unit? First of all, to save the life of the sick newborn. These are the causes of neonatal mortality. So our first objective is to save the life of sick newborn, and then to prevent damage in infants who are born with some sort of problems, so that we can reduce the morbidity in later life, and then to monitor the high-risk babies to reduce the mortality and morbidity. Well, so these are our main objectives of NICU. Now today we will discuss about the organization of neonatal intensive care unit. So till now we have discussed that what do we mean by neonatal intensive care unit, what we do there basically, and what are the conditions that requires NICU admission. Let us understand what is the organization of this particular unit, how it is different from a normal pediatric ward. First, let us discuss about the basic facilities that are needed to organize a neonatal intensive care unit. So the first one is there should be adequate space. It should not be crowded, and then there should be availability of running water. So as we would perform a lot of procedures there, and for that we need to perform hand washing, so for the hygienic measures we need availability of running water. Then there should be centralized oxygen and suction facilities. As I told you that most of the newborns, the neonates who would be in NICU, they would be severely sick. They would have some sort of problems which cannot be managed at the normal pediatric ward. So most of the babies, they need oxygen support. For that we need to have centralized oxygen, and there should be suction facilities also. And then there should be maintenance of thermoneutral environment. For example, if we have a neonate with less than 1500 gram birth weight, in that case you know that the chance of hypothermia is quite high and is required to maintain the stable body temperature in them. So for that we should have, and most of the babies who are in the neonatal intensive care unit, they would be low birth weight or they would have some sort of problems which which we discussed earlier. There is a need of maintaining thermoneutral environment. Then there should be availability of linen and disposables. And then there should be facilities to treat common neonatal problems. So there are certain common neonatal problems which we know that the incidence is high, the prevalence is quite high. So when we are organizing a neonatal intensive care unit, we know that as the prevalence of these common neonatal problems is quite high, so for that we should have basic facilities to treat those common neonatal problems. So these are the basic facilities that we need to have in a NICU. When we are organizing a unit, there are certain components which we can say main components which we should consider. Yes, so what are those? So first thing is physical facilities. So basically in physical facilities, the first thing that we would discuss about the location. So what should be the location of this intensive care unit in the hospital? Well, so while deciding the location, the first thing that we have to consider that it should be near to the labor room or to the obstetrical unit. It should be located to particularly these two units as close as possible, so that while transferring the neonate from the labor room to intensive care unit, it does not take much time, and then where there would be adequate sunlight for illumination and also with good ventilation. This is what we would see while deciding the location. Now the next thing comes in physical facilities, that is space. While talking about space, when we are designing the unit, it is recommended that for each neonate there should be a minimum space of 100 square feet. It should not be less than that. And then there should be space for promotion of breastfeeding, and how much area the bed should cover, that is around 500 to 600 gross square feet. This is about how much space should be provided for each neonate. In this unit, there should be space for the patient care area, then a storage area, space for doctors, and also space for nurses and other staff, and there should be the office area, then seminar room area, laboratory area, and space for families. Well, so we talked about the location and the space. Now the next thing is about floor plan. So it should be an open encumbered space, and the walls should be made of washable glazed tiles, and the windows should have 2 layers of glass, and the doors should be provided with automatic door closers, and there should be an isolation room. So in case if there is any condition which can be spread to other neonates, so in that case we have to keep that particular neonate in an isolated room. So for that we need an isolation room. Next is about ventilation. So there should be proper ventilation. For that there would be central air conditioning. Then coming to lighting. Now as this is a unit where a lot of critically ill newborns are there and a lot of procedures would be performed. So for that we need good lighting. So for that the whole unit should be painted white and it should be well illuminated, and the lighting arrangement should be uniform and it should be shadow free. So basically there should be good lighting. Now the next thing is about sound. Now as I told you that there are a lot of equipments would be there, such as the ventilators, then the incubators, air compressors, suction pumps, and many other devices. Now these devices produce a lot of noise, and there are equipment alarms also. So for these equipment they would set alarm. So these alarms or telephone rings, this can be replaced by blinking lights so that we can prevent excessive noise. Next, coming to communication system. So how the communication system should be. This unit should have intercom and also a direct outside telephone line. The next is about electrical outlets. Now each patient station should have 12 to 16 voltage stabilized electrical outlets so that it is sufficient for all the equipments. There should be an additional power plug point, and also there should be round the clock power backup with UPS system. So this is how the electrical outlets should be there. This was about the physical setup that we need to do. Now next, coming to personnel. We need staffs in the neonatal intensive care unit. Who are these staffs who are required in neonatal intensive care unit? So there should be a full-time neonatologist and one neonatal physician should be there for each 6 to 10 patients. Then one resident doctor should be present in the NICU round the clock. Then there should be anesthetists, pediatric surgeon and pediatric pathologist also can be there. Then coming to nurses. So how many nurses are required? What is the nurse-patient ratio that we would see here? Basically in the NICU, the nurse-patient ratio is 1:1. So for each neonate neonate, there should be one nurse. If there is multi-system support, or the neonate is on ventilator, in that case they maintain 1:1 nurse patient ratio. And if there is special care neonatal unit, intermediate care, so for that they give 1:3. And then there should be a head nurse who is the overall in charge. These nurses, they should be well trained on these, how to handle these equipments and the use of ventilators, and also the usage of the several equipments or the instruments. They should be also competent enough to do arterial sampling, and then to start any life support procedures is bag and mask ventilation or resuscitation. So these staffs, they must have 3 years of work experience in a special care neonatal unit, and with that they should have 3 months of training in intensive care unit. These are the nurses who would be assigned to work in NICU. Now, other than doctors and nurses, we need some other staffs such as a respiratory therapist, we need lab technician, we also need public health nurse or social worker, then there should be biomedical engineer and then clerk. Now, there are certain disposable articles which are required in the NICU. So first of all, we need IV catheters, IV set. Then we need feeding tubes, endotracheal tubes, suction catheters, and 3-way stopcocks, extension tubing, umbilical, arterial and venous catheter, then syringes and needles. Now, these are disposable articles, so there should be enough supply of these disposable articles. So the equipments or articles, it should be available, and it should include all the equipments or instruments which are necessary for resuscitation or immediate care. And the supply should be close to the nurse's station so that there is not much waste of time in getting the supplies. And we also have to make sure that there is adequate number of equipments and adequate number of the supplies. We already saw that what are the disposable articles that we need. Now let us see what are the equipments of NICU, what are the equipments that are majorly used in NICU, and we need to keep those in NICU. First thing is ventilators, which are used to establish breathing in neonates. Basically, there are 2 types of ventilators, that is positive pressure ventilators and then high frequency oscillating ventilators. Apart from these, there is also CPAP, which is known as continuous positive airway pressure. So the ventilators are usually used to provide oxygen to the neonates. Then we have an apnea monitor. So this apnea monitor detects when the neonate stops breathing, so that, and it originates an alarm, so that all the NICU staff, they would be aware that the neonate is not breathing. So most of the time what happens, the nurse or the doctors, they might not be near to the neonate when there is an episode of apnea. So that is why there is this monitor which would continuously monitor if there is an episode of apnea, and it would generate an alarm. This would help the staffs to get to know that there is a neonate who is not breathing, there is an episode of apnea. And then there would be an arterial line, which is a thin tube which is directly inserted into the artery. So this would give reading of blood pressure and it would measure the blood gases. Then there will be also a blood pressure monitor. This monitor would take the reading at regular times and it would be displayed on the screen. Next, there is cardiopulmonary monitor. So basically this cardiopulmonary monitor tracks the unit's heart and respiratory rate. Whenever there is the heart rate goes too high or the breathing rate goes too high or vice versa, if it comes too low also, there would be an alarm and the staffs would get to know about that. Then there would be a central line. This is a small plastic tube kind of thing which is through which we give medicine, we give fluid to the baby. Next is endotracheal tube. So basically this endotracheal tube it goes to the trachea, and this tube is attached to a mechanical ventilator from where we provide oxygen to the neonate. And then we have an extracorporeal membrane oxygen, which is also called as ECMO. Basically what this machine does, this machine takes all the blood out of the neonate's body and then it gives oxygen and then again it sends to the body. So that is what ECMO does. Then apart from this, there would be gastrostomy tube. This is also called as G tube or gastric feeding tube. Basically this tube goes directly into the stomach for feeding and we provide food through this. Then one important thing, that is incubator. So this is to keep the baby warm. And then apart from these things, we have intravenous line, then the nasal canal cannula and the nasogastric tube. I think you already know that this tube is inserted into the nose, and through this we provide fluid or a food to the baby. So we can give breast milk or formula milk, or any food that is recommended for the baby. And then we also have an orogastric tube. So this tube basically goes to the stomach from the mouth. We insert this orogastric tube in the mouth and then it goes till the stomach. And this is also used for feeding. So there would be a pulse oximeter, which is a small device which gives you actual saturation in the neonate's blood. And then we have radiant warmer. So basically, if the baby should be handled a lot and there are a lot of procedures should be performed, in that case there would be a lot of handling involved. For that, we don't use incubator and instead we recommend radiant warmer. So this is also to keep the baby warm. And then there should be tracheostomy tube. This tube goes directly to the trachea, so it is inserted into the trachea. Then there would be an umbilical catheter and urinary catheters. Umbilical catheter we use for providing fluids or medicines, and the use of urinary catheter. Next, there should be laboratory facilities. Lab facilities should be there so that any investigations that should be done, any sample that has been taken, there should be a system so that can be sent to the laboratory as soon as possible, and the investigations can be done at the hospital itself. And also it would not need transportation of sick newborn. As I told you that these neonates would be critically ill and they need intensive care. Even if we need any sort of diagnostic procedures we need to perform, so for that there should be the lab facilities should be available in the NICU, so that we don't have to transport the sick newborn to the laboratory or to the another area. And then there should be procedure manual. A lot of procedures will be performed in a neonatal intensive care unit, and for that there should be a manual which should be followed. Whoever doing this procedure, we should follow the protocols and we should follow the manual. So for that, in the NICU there should be manual available for each procedure. And then there should be a cooperation or communication between the obstetrician and the neonatologist. What are the antenatal care that has been provided to the mother? What was the fetal diagnosis? If there was any incidence of perinatal hypoxia, and there is a supervision of low birth care. So for these things, there should be a good communication or cooperation between the obstetrician and the neonatologist. Well, so this was all about the main components which should be considered while organizing an NICU. Now the next thing we will discuss about management of nursing care. So as a nurse, this is very important for you to know that what is your role to do in an intensive care unit. First thing that comes is definitely assessment. So you have to assess the neonate regular interval. If there is any sort of danger signs, or you can see any abnormalities or any deviation, you have to report to the neonatologist. Then you have to monitor the physiological data. So whatever baseline data that you are getting, that you have to continuously monitor. Any significant changes, then you should report it to the doctor. Then you should also see about the safety measures. So the procedures, whatever you are doing in the intensive care unit, you should do it with all the safety precautions, and you should follow all the safety measures so that there is no spreading of infection or there is no harm to the neonates. Then the next thing is respiratory support. So you also have to provide respiratory support, the ventilator, and you have to check what mode of ventilator has been used for the neonates and whether the neonate is receiving adequate amount of oxygen, whether whether the respiratory rate and pattern, everything is normal or not. Then after respiratory support, your one more responsibility is thermoregulation. As you know that there would be low birth weight babies and there would be critically ill neonates who would be more prone to hypothermia, and we have to prevent that in neonates. For that, one of your roles is thermoregulation. So you have to place the baby in incubator or in radiant warmer, and even for whenever you are handling the baby, you have to make sure that there is no unnecessary exposure of the body parts, and you cover the neonate properly so that there is no unnecessary heat loss from the body. Next is protection from infection. Now here, as there will be a lot of neonates with several other conditions, and there is a high chance that there can be transmission of infection from one neonate to another neonate. So as one nurse would be handling maybe 2 or 3 neonates neonates, or sometimes even if it is one neonate, then also there is a chance that they might be, if we don't handle the equipments properly, there is no proper cleaning of the equipments, then there might be transmission of infection. So we have to prevent that. As a nurse, it is your responsibility to check that the equipments and the instruments, whatever you are using, it is sterilized. And if you find out that there is any infectious cases or any neonate is present with any infectious diseases, that patient should be isolated. So that is how you have to protect from infection. Also here it is very important to use the protective measures, such as gown, the mask, cap, everything. These are very necessary for the intensive care unit nurses to not only to protect the neonates but also to protect themselves. You have to remember that you have to protect from infection. Next is about hydration. So you have to make sure that neonate is receiving adequate amount of fluid and they are not dehydrated. After hydration, there is nutrition. So about nutrition also, you have to make sure that the neonate is receiving adequate nutrition. So whatever the method of providing feeding is, that might be orogastric tube or nasogastric tube or a gastrostomy feeding, you have to check that they are receiving adequate amount of nutrition. And through whatever method you are providing the nutrition, you should make sure that there is provided with following all the safety measures and precautions. Next is about the skin care. So you also have to take care of the skin of the neonates. And the next is administration of medication. Now, as we know that these neonates are critically ill, they would receive a lot of medications altogether. We learned about the equipments and articles that we need for NICU, and we learned that we need umbilical catheter, we need arterial line, central line, and these neonates, they would receive several medications together. So as a nurse, it's your responsibility to see that the neonate is receiving all the medications on time, and if there is any adverse effects, that you should document, you should report to the neonatologist, and what is the result after giving the medications, that also you should note. So administration of medication is one of the major responsibilities that you have in NICU. The next one is about developmental outcome. So as these neonates will be in the intensive care unit and we are providing nutrition, adequate nutrition, we would provide hydration, a lot of therapies would be done, a lot of procedures would be done. So our main aim is that the neonate should have development. So we have to check, as a nurse, it's your responsibility to check whether there is, what is the developmental outcome. And if you find out that there is, there's any abnormalities, any deviation in that you should document and you should report to the neonatologist. Also, these neonates would be separated from their mother. As they are in the intensive care unit, they need intensive care, intensive monitoring. They would be separated from their mother, and we know that this is the period of time where there would be establishment of emotional bondage with the mother. As a nurse, what we have to do here, we have to facilitate the mother and infant relationship. Not only mother and infant relationship, but also the parents and infant relationship. We have to, even if they are separated, we have to make sure that try to facilitate the parent and infant relationship. And then at last, one of the responsibilities is discharge planning and home care. So what should be the discharge plan for the neonate, and then the home care, how they should take care of the baby in the home. So that you should plan and you should educate the parents about that. So this is what is management of nursing care. Now there are certain levels of neonatal care. So we basically have 3 levels, that is level 1, level 2 and level 3. So what is the level 1 care? This is very minimal care and this provided by the mother but with the supervision of healthcare members. So neonates who weigh more than 2000 grams, their gestational age is 37 weeks, they would be under this care. So in this, basically there would be care of delivery, then provision of the warmth, and we have to maintain asepsis. There should be promotion of breastfeeding. So this is what is level 1 care. Now what is level 2 care? So this care is basically for the neonates who birth weight is in between 1500 gram to 1800 gram, or their gestational age is between 32 to 36 weeks. So basically in this care, there's a need for resuscitation care. Then we have to maintain the thermoneutral environment and also intravenous infusion, gavage feeding, phototherapy and exchange transfusion. So these are the cares that are involved in level 2 care. Now what is level 3 care? Well, so this is basically for babies who are critically ill or whose birth weight is less than 1500 gram and also their gestational age maturity is less than 32 weeks. So basically in this they need life-saving support, for example support of ventilator. So this is what is level 3 care. This was all about what are the levels of grades of neonatal care that we have. Now next let us see what are some of the points towards a gentle and friendly NICU environment. So there are certain key points we need to keep in mind to provide a gentle care in NICU and to have friendly NICU environment. So first thing, there should not be any unnecessary sound or light. So we have to avoid excess of light, excess of sound, and the handling of the neonates should be gentle. And these neonates, including the preterm neonates, they feel pain. And if there is any painful stimuli, that can cause physiological trauma. So that's why whenever we are doing any kind of procedures, including ventilators, we should administer analgesia. Then the parents should be allowed, and whatever tubings that are attached to the baby, you should explain about the functions of each tube and what is the indication, why it is attached to the baby, what it is providing, and how long it will be there, if there is any complication. So everything you should explain to the parents so that they don't feel anxious about their child's condition. These are some of the key points we can make a gentle and friendly NICU environment. Well, so let us conclude today's topic. So today we learned about organization of neonatal intensive care unit. So basically in this unit there would be neonates who are critically ill, whose birth weight is low or who's having any kind of congenital anomalies, any sort of conditions which need life-saving support. These neonates are treated in this particular unit to reduce the mortality and in their later life. And we discussed about what are the objectives, what are the basic facilities that we should have, and while organizing the NICU, what are the main components that we should keep in mind. So this was all about the organization of NICU. I hope you have got a better insight about the topic. Thank you.